So, Chad, a little more on drug coverage. So, everybody knows that we've got a 90%, 10% cost sharing plan. So, they
Yes.
pay 10% for prescription drugs.
Yes.
Can you explain a little more about how does the chamber determine, is this drug covered or is this this drug not covered? Because new drugs are flooding the market every day.
Absolutely. Yes, so the Chamber's plan does use what's called a formulary.
Okay.
And we have in the formulary and in the Chamber's plan, we use a formulary to evaluate drugs and their cost and their therapeutic value. And this formulary allows us to understand what prescriptions are being used and which ones may be an alternative to what you're already using. Essentially, just like we're using the Chamber's plan as an opportunity to manage costs. This is one other tool that the Chamber's plan uses to manage those costs. We want to make sure people are using the right prescription at the right cost. Now, that being said, we want to make sure that the prescription that you need is in your hand. So
Right.
there's nothing there. But this is a situation where we always want to make sure, because sometimes people can get on a medication and be on it for a period of time and not even realize there is an alternative that could be available that would be less costly to them and to the plan, and that may be an option, but again, just unaware. And this is just an opportunity for us to evaluate that. So what the plan looks like and the formulary looks like for the Chamber's plan is that we have a program set up that's going to be a 90% copay and a 10% copay for the employee. There's an opportunity that your drug may be covered at 50%. So the plan design is situated like this. Drugs are going to be covered at either 90 or 50% through the Chamber's plan. What we want to do, and we want to mitigate any type of issues when it comes to the pharmacy, when you show up, and you go to pick up your prescription, and it's a $50 prescription, and you're expecting to pay $5, and they say $25. Well, we want to make sure that that doesn't happen, but we want to ask the question: is there a reason that we couldn't use, an alternative drug? That we can decide before. What we can do in that particular case is we can run medication DIN numbers prior to you going to the pharmacy. So if you have existing medications and you would like us to run those drug identification numbers, and those are numbers, DIN numbers, located on your prescription, you can call our office, you can call Alicia and Lori or myself, and pass those along. We can run those instantly, and we can let you know which ones are covered at which levels, and then we can have that discussion. Some drugs are, we just ask the question, and not necessarily us, but we could ask your pharmacist, are there alternatives? And possibly there's not, and that is fine. We just have to ask that question. Again, for the greater good of all of the plan and the plan for RCS, we just want to make sure. It's just an opportunity to ask the question because it hasn't been asked before.
Right.
So this is, again, in the big picture. We want to help ourselves.
Right.
So 90, 10, possibly 50. But again, please reach out prior, during the changeover or prior to, and we're happy to run them so there's no surprises. And then we can have those medications adjusted, if need be, to the higher rate without an issue.
Right. So
Yeah.
your medications will be covered,
Correct.
but there may be questions asked, a little conversation that you could have with Chad or his team
Yes.
to determine whether or not it's necessary for you to have that particular drug. Because in some cases, if the plan will continue to pay for it, the doctor will continue to prescribe it. And all we're doing is asking a couple of questions to find out, is that necessary?
Absolutely.
Because the cost of the drugs is what drives up the cost of the premium that you pay from your paycheck every week. So we're trying to find the best way to manage those costs while making sure you get what you need.
Exactly. This is no different than Manulife. You know, they are not. They are using a formulary behind the scenes. They're not upfront about it. They're not. They're managing it for their own needs, but it is in place. So it's not something that you haven't been exposed to before, whether you know or not.
We're just telling you about it.
Yes, that's right. We're just being upfront because, again, we would like to mitigate any questions or any problems, and it's very easy to do that. Again, it's not. Myself and my team are not there to ask questions, personal questions about it. It's again of questions that you would have with your pharmacist and so on and so forth. All we're saying is, hey, this might be an alternative, or we may have an opportunity to get a cheaper. Let's just have that quick conversation, and then if not, if those are the ones that we need, no problem, we'll get them.
Right.
Yeah.
So the majority of the drugs are going to be covered at 90%.
Yes.
There are certain circumstances where we will run into one that comes back and it says, oh, no, it's only covered at 50%. So this video is specifically to tell everybody, don't worry, don't get
Don't
upset
panic.
if that is the case. And if you provide Chad and his team with your DIN numbers before the chamber plan goes live, if you're concerned about this, they can figure that out all before you ever
Absolutely.
go to the pharmacy or order them through Pocket Pills, whatever your choice is.
Exactly.
Okay.